Past 8 o'clock here on this Wednesday morning, and it's time for Wednesday with Wagle. Dr. Jason Wagle at Kansas Perio and Dental Implants with us this morning. Good morning, sir.
Good morning, Steve. How are you doing today?
I'm hoping you didn't have any trouble driving in or wherever you've been going this morning.
Yeah, it's snowy. It's bad.
Okay. Hey, what are some of the signs that a person may have a dental problem and should go see a dentist?
You know, there's several things that should probably be evaluated by a dentist. If a patient's having mouth or jaw pain or sensitivity while eating, they should probably have that checked out. Other things, real quick here, are if they're having sensitivity to hot or cold or sweet foods and drinks, swelling inside your mouth or along your jaw, those are things that should probably be checked out. Even if it doesn't hurt, swelling is not necessarily good. Bleeding gums while brushing or flossing, a bad taste in your mouth that won't go away, sores along the gum line, broken or worn teeth. If you're seeing spaces develop between your teeth or shifting teeth, or your teeth are getting loose, that's something that should be evaluated. And, dry mouth is something else that can be a sign of dental problems or could lead to worsening dental issues.
So what can we do to improve our oral health and help prevent these kind of problems then?
We've talked about this before, but in general, gum brushing, flossing twice a day, avoiding clenching or grinding your teeth or habits such as chewing ice, avoid acidic beverages or sugary snacks, drinking plenty of water, avoid smoking. If a patient's concerned about something like stain or tooth discoloration, they might, try to avoid coffee, tea, or red wine and consider brushing with a whitening toothpaste or baking soda.
You mentioned something there that I'm going to grinding your teeth. I happen to know a couple of people who grind their teeth at night, and there are some things that can be done to help out with that, right?
Yeah, you could have an appliance made. Sometimes it's just a matter of getting your bite evaluated. Could be a more serious issue too, leading to temporomandibular or jaw joint problems. But that's something else, a good reason to maybe have that checked out. Prevention is the best medicine. Yeah. I think that seeing your dentist regularly can oftentimes prevent having things lead to bigger problems. Is
once a year enough to go see the dentist, or does it depend on the patient?
Yeah, it depends on the person. If a person's having, has a high risk for tooth decay or gum disease, they probably should be seen more frequently than even twice a year. They may need to be seen 4 times a year.
Yeah. So what's the youngest age where you recommend you take your youngster in to see the dentist? Oh,
that's a great question. Babies should start the habits of seeing the dentist pretty regularly, and it's not a bad idea to even start practicing brushing their gums at home when they're young, just to get them used to the feel.
And another thing I thought of, if a kid has any fear of the dental chair, getting a relationship going there, it'll take a little time sometimes for them to get to know you and you to get to know them and get them comfortable in the chair.
Yeah, relationships are really important in dentistry. Trust and relationships are really important.
All right. Hey, thank you for your time. Be careful out there on those streets this morning. Okay.
Hey, thank you too. Yes.
But it's time to get serious about your smile. Time to ask your dentist about Kansas Perio. Learn more about their services online at kansasperio.com or call 316-685-2731. Wednesdays with Wagle. Dr. Jason Wagle helps us out with some tips on dental issues every Wednesday at this time, 8:16 now. Steve and Ted here on KN.